What exactly is a dermal filler? How is it different from Botox? What are the risks of dermal filler? To get answers to these questions, do watch our video and do subscribe to our channel if you wish to see more such videos. So dermal filler is completely different from what a Botox is. Whereas Botox is botulinum toxin, which is a toxin which paralyzes or fixes the muscle. A dermal filler is a soft tissue using as a filler substance which when we inject into our skin or below the skin will give us volume. So while we use Botox mainly for the upper face to reduce these wrinkles that develop on the forehead or around the eyes, or maybe these 11s that develop, which are also called as the frown lines. Ideally, we would want to fill up the cheeks, the area near the zygomatic area, to give them a more lifted look. So to summarize, Botox acts by numbing the muscle and thus reduce the dynamic wrinkles. But filler are for static areas, static lines, in which we can fill the filler substance beneath the skin, which is like an implant, reduces or diminishes those lines. It is used to volume up your face. Since with aging, the volume of the face reduces and there is a change in the volume of the face. With fillers, what we achieve is we fill up, we give volume to the upper face, we give volume to the areas that have lost some volume so that they get replenished and you get back a more beautiful and a much better and a beautiful face. So if I have to summarize, Botox and filler, they are completely different. We have made a video completely on Botox and you can go and check it out to understand in detail about the Botox. So first we'll talk about what actually a filler is. So filler, the most commonly used is a hyaluronic acid filler. Hyaluronic acid is a naturally occurring substance in our body which makes the ground substance of the human body. What we have done is we are able to capture this hyaluronic acid, make it into syringes, and this ground substance can be injected into areas which have lost volume or can be injected into areas which we want to have more volume. So to summarize, the indication and benefits of filler could be for static lines on the forehead, the dark circle under the eyes, to improve the cheekbone area, to fill up your mid-face, for a good chin, or maybe for your jawline, and for acne scars, for your chickenpox scar, or any depression in the body which needs to be filled. An ideal candidate for a filler should be in her 30s or 40s, not a very mature person. The best and the worst part of filler is that it is temporary. It is good because even if you don't like it, we have injections or the modalities to dissolve it. If you don't like it, it will go away in 9 months to about a year's time. And it is the worst part as well. So if I talk about the side effects or the risks of filler, in case the fillers are injected into the blood vessel, it can travel up through the blood vessel and block that particular area where the blood vessel is supplying. So it is always important to visit qualified plastic surgeon or a dermatologist who does regular fillers and Botox in his practice. There may be instances of allergies to the fillers which is reported in very rare instances. Other than that, a filler is a very safe procedure and is one of the most common non-surgical procedures being practiced these days. If I talk about the procedure itself, the procedure includes taking photographs, having a proper consultation with your doctor in which he would inquire about your medical history. They would want to know any medical condition that you are suffering from and you should tell them the last fillers you had and where you had it. Once all said and done, they would take your photographs, explain you the procedure. Once decided on the volume of the filler, they would want to decide on which substance they would want to fill. There are different kinds of filler for different areas of the face. They would clean your face. They might apply some sort of a numbing cream on your face. Usually takes around 15 minutes to 30 minutes. The procedure is very simple and does not carry much side effects. You can join back your work on the very same day you have had your procedure. The fillers, they tend to swell up in the coming week or so, and thus we keep a follow-up of about 1 week, and after 1 week we would want you to come back and then we can go for a touch-up procedure in case there is any asymmetry or there is some deficiency remaining, or if we need to add on to some more filler. So this is in crux what a filler is and how it is different from a Botox. To see more videos on non-surgical procedures and surgical procedures related to plastic surgery, to subscribe to our channel. You can visit our website, go through our social media for more testimonials of the patients, and we would like to hear from you very soon. Thank you.